Okay, this is from the book Medical Reformation and Vegan Renaissance, written by me, Pete Rogers, and we're going to do chapter 40 now, which is called back pain, and we're starting on page 607 if you're following along with the book. Basically, the entire book, I put it on the internet for free. This is a book, another book that I had written. This is the cover of it. Ischemic spine is the most common cause of back pain. So here is the lumbar spine. This is L5 vertebral body. Here would be the S1, first sacral vertebral body. L5 means lowest lumbar vertebra. Here's the abdominal aorta, runs right in front of the spine. It gives off lumbar arteries at the mid-height of the vertebral body, and they give off a little twig to the upper end plate and the lower end plate. The disc itself, it's alive. It does not have any blood vessels, but it runs on anaerobic glycolysis. So it receives glucose by diffusion from the end plate, and then it also releases its waste products, which travel back to the end plate by diffusion and then are reabsorbed into the venous system and excreted from the body. And then are remetabolized in the liver and whatever. Okay, but the point I want to make is the disc is alive and it is dependent on blood supply from the lumbar arteries. That's an important point. People get a lot of atherosclerosis, especially on the posterior wall of the abdominal aorta. That can stenose, means to narrow the vessel, or it can occlude it. And then you can diminish the blood supply to the disc, and the disc can fail. I'll show pictures of all this, but basically the outer part of the disc is like a steel-belted radial tire, whereas the central inner part is like a jelly donut. It's called the nucleus pulposus. The outer part is called the annulus fibrosus. So when you diminish nutrient supply to the annulus fibrosus, it can be degenerated, it can dry out and crack, and then the nucleus pulposus can herniate into the cracks and also dry out. That's called a desiccated disc, a dried out disc. And when the annulus fibrosus, the outer steel-belted radial tire, fails, gets a crack posteriorly, we call that an annular fissure, then you can get disc herniations that can cause narrowing of the central canal and compressed nerve roots. I'll show more pictures of all this stuff. Go into a lot more details on all this stuff. Okay, let's see. Okay, so here is another picture of the disc, and this just shows you what the discs look like. You'll sometimes get a normal, smaller L5S1 disc. A lot of that's developmental. They call it a transitional junction between the lumbar and the sacral part of the spine. 2 VBs, and the intervening disc is called a spinal segment. And so the disc helps to equilibrate the body weight distribution when you flex to one side or flex to the other side, forward or back, and it just helps to distribute the weight evenly. So a well-functioning disc helps to evenly distribute the weight, and everything goes well. The spine has an important job. It protects the spinal cord and the nerves. The cauda equina, the lower lumbar nerve roots, are called. And so it has a lot of proprioceptors, means it can sense motion, and it can sense if there's abnormal motion. So when the disc fails, you'll sometimes get a little bit of abnormal motion between the vertebral bodies, and the spine will sense that, and it compensates by laying down bone. Those are called bone spurs or osteophytes. I'll show you pictures of those in just a moment. And I'll make a point here about atherosclerosis. It's sort of like everybody knows that you get atherosclerosis in the heart. That's coronary artery disease. Coronaries are the arteries of the heart. Everybody knows you get atherosclerosis in the arteries of the brain. That's cerebral vascular disease associated with strokes and whatnot. And a lot of people know that you get atherosclerosis in the arteries of the Johnson, 1.5 millimeter diameter pudendal arteries. So you can remember this easy. Arteries of the Johnson are the pudendals, 1.5 millimeter diameter, so those often fail first, okay? Arteries of the heart, the coronaries, are about 3 millimeters in diameter. Artery to the brain, the internal carotid, is about 6 millimeters, so you just double it, 1.5 to 3 to 6 millimeter diameter. So as you can imagine, often impotence presents first with atherosclerosis, then coronary artery disease, then cerebral vascular disease and strokes and whatnot. So it's a good idea to keep all these arteries open, eating a low-fat, low-sodium vegan diet, but very few people actually think that almost all the common vascular diseases of the eye, they're all vascular, Age-related macular degeneration, vascular, okay? Glaucoma, vascular, associated with hypertension. Cataracts are associated with vascular disease, and especially like from drinking milk with the galactose and whatnot. Diabetic retinopathy, that's related to vascular disease, okay? So I just say that because hypertension, that's related to vascular disease. Because all of these things are connected. There's a tendency in medicine to say, oh, these are all these different diseases, we got a different pill for each one. But what I'm saying is if you as a patient, you want to prevent this stuff, prevent vascular disease. How do you do that? Eat a low fat, low sodium, 100% vegan, whole food, plant-based diet, okay? It's just thank God that something works. Instead of whining, oh, I still want to eat meat and fried food, say, thank God I don't have to be fat, sick, and stupid and half blind like almost all these old people. You don't have to be so sick. There's a ton of this stuff. You can prevent it. Okay, so lots of people become blind due to vascular disease of the eye. They become deaf due to vascular disease of the ear and system. So what I'm saying is, it's the same thing in the spine. Everybody thinks in the spine. By the way, one of my fields, my background was as an imaging guided surgeon. Then I became, and I did tons of spine cases, and I also became a neuroradiologist. I was sort of half trained to become a interventional neuroradiologist or imaging guided surgeon in the spine and the brain. But I decided not to go down that path because neurosurgery took it over. Okay, but anyways, what I'm trying to say is I did tons of procedures in the spine, and I've read many thousands and thousands and thousands of spine MRIs. And it's the same thing as everywhere else. It's being destroyed, the spine, by lack of blood flow, okay? Because everybody thinks, they look at a spine MRI, for example, they go, is there a disc herniation, yes or no? Is it a big disc herniation? Does a surgeon need to operate? And that's really sort of a real beginner way to think about the spine. A more appropriate way to think about the spine is, what's going on with the spine? A lot of times you have degenerative disc disease. It's the most common thing, and it's primarily due to atherosclerosis. There's a couple chemical causes of it I'm going to explain here in just a moment. But so what I'm basically saying is, just like you get atherosclerosis in the heart and the brain, you get it everywhere else. It's a systemic, entire, total body disease. Okay. Oh, and I made a little joke here that I should have put the Medusa painting in here, or I could put, like the Chronicles of Narnia, where the people are turning to stone. That's what's happening to people. All their arteries are calcifying, okay, turning to stone, and then they start to get this, ectopic calcifications in the wrong spot, and their spine, and the arteries of their heart, everywhere, and they all become all stiff and can't barely move well. It's the typical old person walking with a walker. Okay, yeah, and a lot of fat people, I see lots of fat people, they're real pathetic with back pain. They're like, oh, if only I could get spine surgery, all my problems would be solved. And I'm thinking to myself, you don't understand. This ischemic spine degeneration, it goes all the way from the lumbosacral junction in the pelvis up to the skull, the cranial cervical junction. You're not going to fix, there's no surgery. You can't operate on every level of the spine. The smart move is, optimize the blood supply and let the spine be as healthy as it can be, and maybe you might need surgery. I made a video a couple days ago about spine surgeon agrees with me. His name was like Gooby, and I mentioned it because he was a MIT, Massachusetts Institute of Technology trained spine surgeon, pretty fancy places, and he had done a fellowship in spine surgery, and he eventually quit because he said he noticed that so many of these patients, if he had delayed scheduling of surgery, like let's say he scheduled it 2 months out, if they ate a plant-based diet and just walked a lot, many of them got better, even if their MRI didn't improve that much. Okay? So what I'm trying to show you is I'm trying to empower you, show you how you can really help yourself a lot if you get it. Okay, another thing is some people really do need spine surgery. Some people really have a developmentally narrow cervical spinal canal. They get a disc herniation and it pushes on their cord. And those are the kind of people who, like, you heard of them, some of these professional football players that have transient quadriparesis from a big hit. They just don't have a lot of extra space in their cervical spinal canal. And nobody knows if you got that or not unless you get an MRI or spine. And you don't want to be getting MRIs for no reason. I don't get on that magnet table unless I have to. Basically the magnet puts you in this giant magnetic vector for an MRI, and 15,000 times the Earth's magnetic field, and then it hits you with these perpendicular gradient fields to knock the net proton vector down by 90 degrees. Then you measure the rate at which it recovers, and you do that many times. Why do you want to do that? Why do that if you don't need it? And most people that get imaged, they don't need it. Okay, they're just sort of ignorant and they're hoping for a quick fix save. All right, so anyways, like I said, some people do have cord compression or something close to it, and they do need surgery, all right? Oh, actually, what can a surgeon do? Let me explain that too, because there's a big naivete about what a surgeon could do. A surgeon can come in from the front, decompress the disc a little, shrink it down a little bit. He can elevate the vertebra, the disc space, so that the foramen that the nerve exits through will have a little more height on it. Okay. He can take off the posterior lamina, come in here posterior between the spinous processes and decompress this, remove this lamina. He can put in, posterior fixation screws. So he can decompress it from posterior, he can decompress it from anterior. He can fuse something, lock it in place so he doesn't have abnormal motion. That's about all a surgeon could do, okay? So it's not magic, all right? He can't improve the blood flow. All right, here's a little more detail about what happens in the lumbar spine. When you have a dried out annulus fibrosis, again, that's the outer part. So here's the annulus fibrosis. It's this outer part like a steel-belted radial tire. And here's the nucleus pulposus, the center that's like a jelly donut. So here's a tear. We call them annular fissures. We call them fissures. So annulus fibrosis, so that you use the word annular. And then fissure, instead, we use the word fissure because it sounds less traumatic than tear, because a lot of times it just happens spontaneously. All right, so when you get a fissure in the annulus fibrosis, the outer part, the nucleus pulposus can herniate into that, and it can extend into the spinal canal. A degenerated disc will also lose height. So this, compared to like the height of this one, this disc is quite degenerated in height. These are the end plates, the lower end plate and the upper end plate of this particular vertebral body. Okay, and that's again where the blood flow twig goes, and then a little bit of diffusion of glucose goes to the disc, and the disc extrudes its waste product. Okay, but you need to get that the outer part of annulus fibrosis is a steel-belted radial tire. The inner part is the center of a jelly donut. Okay, now I'll show you like the terminology for an MRI report. If the disc extends posteriorly just at the level of the disc space in terms of its height, that's called a protrusion. If the disc, when it comes out posteriorly, goes above or below the disc space, that is an extrusion. And these are kind of like code words to the neurosurgeon if he's likely to need to operate or not. So the word protrusion implies a small disc herniation. The word extrusion implies a bigger disc herniation. Even still, the majority of extrusions do not need to be managed with surgery, with an open surgical procedure where they cut out through the back of the spine. One of the problems with these open surgical procedures is you're cutting through the big muscles, the posterior paraspinal muscles. That's going to weaken your spine. That's going to give you chronic stiffness. You don't want to do that unless you need to, okay? You have a really bad problem there. Okay, you also get something called a Schmorl's node, where the disc herniates upwards into the vertebral body. You can have abnormal excessive laying down of fat inside the epidural space. So the spinal cord and nerve roots are enclosed in something called the dura. So just outside the dura, you have what is called the epi, means above or outside of, epidural space. And to get fat in there is it means is like the prefix for fat. So epidural, lipomatosis. I see that all the time. I see it every day, by the way. Tons of people are fat, and if they lose weight, they'll have less fat back here potentially, and they'll get less compression of their nerves for that reason. So that's a wise thing to do. When you eat a low-fat, low-sodium vegan diet, you get better blood flow. Okay, you get more nitric oxide vasodilator. That's all good. There's been a lot of papers about diabetic neuropathy being resolved or markedly improved by going low-fat vegan to improve blood flow, and something similar can happen with the nerve roots of the spine. Okay. Okay, so there's an old Ralph Waldo Emerson quote: "The hedgehog is only one trick, but it's the best trick." And what's the point of that is, the hedgehog can play dead and the other animals leave it alone, apparently, for whatever the reason. But what happens with the spine is when the spine senses abnormal motion between the vertebrae, it gets worried because its job is to protect that spinal cord and the nerve roots. So it says, let's lay down some bone here and fuse these segments. So if you get abnormal motion, let's just say it happens at this level here, at L4-5. You get a failure of the disc. It's ischemic, meaning lack of blood flow, and the annulus fibrosis fails, and nucleus pulposus herniates and dries out. You now have a desiccated, dried out disc, and it has a loss of disc space height, and there's some abnormal motion there. So the spine says, we got to fix this, and it lays down bone. This is called bridging osteophytes. Bone grows from the vertebra below, and bone grows from the vertebra above till they come together and they fuse. Then what happens is now this disc has been fused as if a surgeon fused it by putting in pedicle screws, for example. So now the disc space below and the disc space above, they have to bear more weight. They have to equilibrate the weight better on their own. There's more stress on the disc space above and below. So these segments will tend to fail more rapidly because of the increase in stress placed upon them. So this is called, remember, this is one spinal segment. This is called adjacent segment accelerated degeneration. So these will fail, and then they're going to lay down bone to fuse this segment. And the same process is transferred all the way up the entire spine to the skull, okay? And it's not good to have all the vertebrae fused. Then the person becomes real stiff and awkward, and it's kind of painful for them, so they don't move much. These are the people walking in a walker once this becomes more advanced. But I see dish all day long every day. Not a day goes by that I don't see a whole bunch of patients with this. It's super common, okay? And so what I'm saying is you can't reverse it, but you can stop it in its tracks by improving blood flow. Low-fat, low-sodium vegan with no oils, okay? You know, a lot of people say, oh, I'd rather die than stop eating meat, or some other stupid comment. And what I'm trying to say is you guys don't understand. Unless you do this, go low-fat, low-sodium vegan, you're basically screwed. All this paleo, keto, carnivore, good fat stuff, it's a bunch of nonsense. Look, you know, these are billion-dollar industries. The medical industries, the drug industries, the food industries, the insurance company industries. They need you fat and sick to make money off you, okay? And they like to control you and rip you off. They like you being fat, sick, and stupid. And I can tell you, most older people, that's what happens to them. The only way I know of to prevent it, and I've been studying this in great detail for a long time, is to optimize this diet. Exercise helps a bit. Managing your stress helps. Getting your sleep, it all helps. But the diet is the most important thing. Caldwell Esselstyn said that he didn't tell his patients to do just about anything because he didn't want to tax their willpower. You know, he said people only got so much willpower, if you will. And if you can get them to stick to the diet, that's the most important thing. If you try telling them to exercise or something, you might overwhelm them psychologically. All right, so here's the important point. This is also something I figured out. There were papers written about degenerative disc disease being increased in the setting of increased atherosclerosis of the abdominal aorta, for example. But what I figured out myself, and I tried to publish it in journals and I could not get it published, they kept blocking me, was that it's all the same thing. And what I mean by that is when the disc space fails, you get abnormal motion at that segment, so it wants to fix the problem by fusing. And most commonly it fuses by an anterior bridging osteophyte or same thing at the side bridging osteophyte, and that's called DISH, diffuse idiopathic skeletal hyperostosis. DISH is also called Forestier's disease. But what I figured out was that concept of adjacent segment accelerated degeneration and how it's transferred all the way up to the skull. Because I see these spines all the time and I have to do a lot of procedures on them. Well, I used to. I don't do that many spine procedures anymore, but I used to do all that stuff like epidural steroids, selective nerve root blocks, all of that stuff, discograms, all that stuff. All right, and then what I noticed is it's all the same thing. So what I mean by that is when you get segmental instability, you not only fuse across the anterior vertebra with these bridging osteophytes, you also fuse right across the disc space. That's called an interbody fusion. You'll see bone laid down, calcification in bone laid down in the disc space. Then you'll routinely see calcification of the posterior disc space and that bone becoming larger. And well, sometimes it'll be like osteophytes. We'll call it a disc osteophyte complex, but the bone routinely grows across the posterior surface of the disc space and attaches to the ligament that runs through here, called the posterior longitudinal ligament. So we're ossifying the posterior longitudinal ligament. So the abbreviation for that is called OPLL. And if you read the old books, like from the textbooks from 1990s about spine radiology, they'll say OPLL is a very rare condition, more common in people of Asian descent. And that's absolute nonsense. I see it all day long in Americans, all day long. Not a day goes by that I don't see a bunch of OPL. Now, DISH is far more common, okay? 10 times as common, but OPLL is still common. I expect to see DISH on almost every single patient. OPLL, I see it pretty routinely, especially if you know, it's easy to see DISH on a plain film, like on a chest x-ray, for example. But OPLL, you're usually going to need a CAT scan to see it well, or an MRI is almost as good, but CAT scan is the best. All right, so anyways, super common. And there's also something in the back here. I'm not showing it on this drawing, but there's a ligamentum flavum in the back of the spinal canal. I see that ossified quite often. OLF, ossification of ligamentum flavum. And the posterior spinous processes, I often see those ossified and fused together. Sometimes that's called Baastrup's disease. It's all the same thing. Okay, and I'm going to show you a couple other tricks that almost nobody knows about here in just a moment. And by the way, yeah, the typical person with an autofused spine and multi-levels walks around with a walker. One thing I should point out too is the types of fractures they get. There's a little more interesting stuff. Sorry about that. Let me go back to what's interesting. Because these osteophytes are bearing a large amount of the weight, you get stress shielding of the adjacent vertebra. So when something bears more weight, that's called the Wolff-Parkinson-White law, it becomes more mineralized, that part of the bone. When something's no longer bearing as much of the weight, like the anterior vertebral body, because it's shielded from the weight bearing by these bridging osteophytes, that's called stress shielding. It becomes osteoporotic, or osteopenic is the word often used. And what I'm saying is I see patients have a minor fall, just like getting from their motorized scooters to a chair, and they'll fall backwards, and they can get major fractures. The force vector will find a plane between these osteophytes through the softened bone, and it'll go all the way through the bone, and it'll sometimes go all the way through the center of the canal and through the posterior elements that are also fused. And that's like snapping a piece of chalk, so those are called chalk stick fractures. The thing reminiscent of that, if you just had the old lap seatbelt, you can get something called a seatbelt fracture. That's also called a chance fracture, where the fulcrum is over the belt. That's why they put an angulated shoulder belt on the seatbelts to distribute the weight over a larger area, so the person's less likely to fracture their spine and injure other parts of their body. And so what I'm saying is a autofused spine from top to bottom due to top to bottom spinal degeneration, primarily due to ischemia, predisposes people to chalk stick fractures. I see a chalk stick fracture about once every 3 months. Okay, it can be pretty bad fractures. I've seen patients get chalk stick fractures of their thoracic spine and become paraplegics from that. Because you're normally young, middle-aged, healthy person, you or me falls down. We just put our hands out, we catch our weight, we get up, we're a little bit embarrassed, but we're fine. Okay, whereas these old people walking with a walker, they fall. They'll sometimes get chalk stick fractures and become paraplegics. Okay, some of the ways to treat spinal injury or back pain. You can give people medications, analgesics. You can inject steroids, selective nerve root blocks, or epidural space nerve blocks. Surgeons can do decompression procedures, decompress something like we talked about, open up the posterior spinal canal. They can lock something in place, fuse it with a pedicle screw fusion, for example, in the lumbar spine. Cervical spine, they can do an ACDF, anterior cervical discectomy infusion, and restore disc space height. They've got some procedures where they can inject things into the disc, almost like to glue them fixed, and that'll sometimes be helpful. Ultimately, though, long term, you're going to be a lot better off if you get good blood supply to the spine. Everything in your body works better with good blood supply. When you don't have good blood supply, you just get this progressively worsening degenerative disc disease. Sometimes you need rest in the short run. Walking a lot often helps. Physical therapy can be helpful to these patients as well. Making sure you're lifting things correctly, using, bending at the knees instead of the waist. Chiropractor, I've seen that potentially be helpful in the lumbar spine. I don't think you should do it in the cervical spine, though. You can get an arterial dissection. It's rare, but it can happen, and that can cause a stroke. Acupuncture is kind of like distraction. Gets your mind off of it. TENS unit is almost like a little electrical current. It's called the gating theory of pain, whereby you activate these big neurons, and they're sending a lot of electrical impulses to the brain. The little small pain fibers kind of get hidden in the mess. It's like somebody giving you a back rub. It feels good, and it distracts your mind from whatever pain you were having or discomfort. I talked about the nerve blocks and the epidural steroids done with fluoroscopy guidance. Open surgical procedures, yeah. And then, the plant-based diet, like I said, it improves blood supply. But I'm about to get to something else I think you're going to find real interesting. Oh, the plants are good in just numerous ways. They've got the potassium vasodilator, magnesium vasodilator, the nitrates, vasodilator precursors for nitric oxide. They're low in fat. They're low in sodium typically if you don't put salt on them. All of that is good. Walking is good too because it gets the muscles going. It opens up the vasodilators to the spine. Okay, so ischemic spine is the most common cause of back pain. There's a couple things I didn't put in there. I didn't get to put my slide in there that I wanted to tell you about. I kind of covered it in another chapter, but there's 2 other things you need to know about to be intelligent for the spine. You can look this up in 5 seconds too. They write about glyphosate. So the ligaments of the spine are largely made out of collagen. There's an anterior longitudinal ligament running up in the front. There's a posterior longitudinal ligament running up in the back. And ligaments, again, are primarily made out of collagen. Collagen is like 1/3 of the proteins in the body, and it has a triple helix. So that triple helix means 3 protein fibers, and they're wrapped around each other, okay? And then what happens is, in order to wrap 3 things tightly around each other, you need to have some small amino acids in there. If you have an amino acid, you've got amino on one side, carboxylic acid on the other side, you got a hydrogen like for head, and then the part coming down, that's the R group, the variable. The smallest one is glycine. It only has an R group of hydrogen. So a small side chain enables it to fit well in these triple helices. Every third amino acid on collagen is a glycine. So what they spray on GMO soy is something called glycine phosphate or glyphosate. I like to call it glycine phosphate because it tells you what it is. Glyphosate's a little more perfect in the pronunciation. Some people then give me a fuss about that in the comments. Okay, but so what I'm saying is glyphosate, GP I often abbreviate it, GP, that can substitute in for the glycines, and it messes up the collagen, because instead of having just a glycine with a hydrogen side group, you get this big bulky phosphate on there. Glycine phosphate is what it is. And then your collagen isn't wrapped as tight and correctly, and it weakens your collagen. Okay, so tons of people eat that junk on all the processed foods. Soy is the most common source of cheap protein in all these processed foods. All right, so not a smart move to be eating that stuff. You're going to have weak ligaments, and you're more predisposed to dish and these problems in the spine. Okay, Stephanie Seneff is the lady who often writes about that. Okay, so what else am I saying? Also, fluoride, F- is how I usually abbreviate it. That can intercalate itself into the hydrogens and break some of the bonds in your collagen, and it messes up your collagen. There's a disease of the spine called fluorosis, spinal fluorosis. And there's some endemic areas like in India and some other places where the fluoride's real high in the exposure to the people. And they get a disease of the spine that's very much like DISH, diffuse idiopathic skeletal hyperostosis, makes the spine brittle, makes the spine weak, and it weakens the collagen ligaments. So when the ligaments are weak, you're going to get more segmental instability, and you'll be predisposed to forming all these osteophytes and end up with this brittle, weak spine. So you should minimize your exposure to fluoride. You can remove it from your drinking water by having a reverse osmosis filter. You can move to an area where you don't have to have it in your water, because you can have well water, or if you're lucky enough to find a town, a municipality that doesn't put fluoride in your water, that would be preferable. It really shouldn't be in your water. It's stupid for it to be in your water, okay? That's all nonsense. It's another one of these slow poisons that just weaken the American public, okay? So that's good to know. You want to avoid that. You don't want it in your toothpaste either. And don't tell me it's good for your teeth. Just think how stupid that is. If it was good for your teeth, you would have a topical application and spit it out. You wouldn't swallow it like people do with drinking water. It has the highest electronegativity of any element in the whole periodic table, meaning that it very tightly wants to grab onto electrons, which is almost the definition of a pathogen, something that steals electrons and doesn't give them back. It's because its outer orbital, its octet is incomplete. There's one unpaired electron, so it wants to complete that outer orbital octet, and it does so by grabbing an electron. So it steals electrons, meaning it's a free radical, electron stealer. It's a pathogen. It's a major pathogen. It's also brain toxic, neurotoxic. And so what I'm telling you, it's toxic to your spine. So those are ways you can avoid it. Now, another thing people sometimes tell me, how am I so sure I'm correct about the spine fusing segments of segmental instability? And the way I can tell you that I'm totally 100% confident about it is I see a lot of spine fracture. So you'll have a normal looking spine with none of these bridging osteophytes. And then you get a fracture. There'll be abnormal motion at that level, and you'll form these bridging osteophytes just at the level of the fracture. I'll also see patients with spinal cord injury, and they'll have a cord injury, and they'll do this multi-level posterior laminectomy to decompress that area. And then they'll get OPLL and DISH just at the level of the surgery. I see this all the time. So I've seen that so many times, it's old news. And at the level where the disc fails, I'll see more of these bridging osteophytes and stuff. So I've been there, done that. I've given more extensive lectures on the spine than what I included in this chapter in the book. But it makes the point that what can you do to improve your spine? Reduce your stress level, make your blood less thrombotic, improve blood flow, avoid caffeine, get your sleep. All of those things will improve the way your spine feels. And also, the psychological stuff. I've talked about that in other chapters. So anyways, that's all for this chapter. I hope that was helpful to you.